So today I wanted to spend some time talking about the coronavirus. Specifically, I wanted to discuss how the virus is spreading across the United States, and more importantly, how a lack of federal response to that spreading is greatly hurting the nation. ProPublica put out an article on December 1st called States with Few Coronavirus Restrictions Are Spreading the Virus Beyond Their Borders. The article goes on to make the claim that as the number of COVID-19 cases skyrockets nationwide, the extent of the public health response varies from one state and sometimes one town to the next. The incongruous approaches and the lack of national standards have created confusion, conflict, and a muddled public health message, likely hampering efforts to stop the spread of the virus. The country's top infectious disease expert, Dr. Anthony Fauci, said last month that the country needs a uniform approach to fight the virus instead of a disjointed one. Now, pausing right here, I personally believe that we should have had a federal response, a unified federal response, as early as April, when the US shut down all of its borders to everyone except Europe, which honestly we should have shut down to Europe as well. We should have sought out a unified response across the country in order to prevent the virus from spreading. The reason we didn't, of course, is because Donald Trump and the Republican Party pursued certain avenues of mask denial and going against Fauci's wishes and all the stuff that we're all familiar with in that history. But where we are today is something that I want to discuss. We are not in some fictional reality where the states are separate from each other. This isn't, the early 19th century where traveling from one state to the next might have taken you an entire day or multiple days to do. This is not a situation where we can assume that people aren't going to travel. We live in the 21st century. And in this reality, you can take a car from one side of the country to the other with two people switching off between driving and sleeping, probably in about 2 to 3 days. And given that, the Trump administration really should have been on this and on the lived reality of people. I know I'm asking a lot, but he should have been on the lived reality of people and focused on not this states' rights rhetoric, but rather on an institutional understanding of how the country works and what the best response was for the current reality and lived conditions of our country. Given that, let's get back to the article. Nowhere are these regulatory disparities more counterproductive and jarring than in the border areas between restrictive and permissive states. For example, between Washington and Idaho, Minnesota and South Dakota, and Illinois and Iowa. In each pairing, one state has imposed tough and sometimes unpopular restrictions on behavior, only to be confounded by a neighbor's leniency. Like factories whose emissions boost asthma rates for miles around, a state's lax public health policies can wreak damage beyond its borders. In some ways, the whole country is essentially living with the strategy of least effective states because states interconnect, and one state not doing a good job will continue to spread the virus to other states. And this was said by Dr. Ashish Jha of Brown University. So, given all that, there is a cliched phrase, I believe at this point, that a chain is only as strong as its weakest link. We're living proof of that right now. The states that do not have restrictions in place are affecting everyone else. They are causing that snap, that separation from us and a proper response to this virus. I get the fact that these restrictions are unpopular. The US kind of is not used to having to, go for these greater good arguments. We haven't done it in a really long time. And given that, I think it was even more important to have a federal response for all this, or to try to find a federal response in the coming months. Because if not, we're going to keep seeing situations like this between states like Washington and Idaho, Minnesota and South Dakota, Illinois and Iowa, Because when one state locks down and the other state stays lax, people from the lockdown state travel into the lax state. Why? To go to festivals, to go to public events, to get out of the house, to ignore mask mandates, to ignore whatever reason they want to go out and be amongst people. And while I get that these are unpopular restrictions, they're necessary restrictions. This restriction on freedom is meant to, in a general greater good argument, say that we are going to sacrifice a period of time where we take all these restrictions and then we can get back to life as normal. But no, the consensus from the Republican Party, from conservatives, and from reactionaries has been to consistently ignore all of these mandates, ignore the basic facts of science, and to continue down a path where they are wrecking this country. And as people travel to these other states and they come back with the virus in tow, do they just stay in their homes, do you think? No. They end up going out to shop for food. They go to whatever little things are open in this much more restricted state. They spread the virus to other people. Their kids take it to school if schools are open. If they're not open, they're probably the type of people who are probably letting their kids play with other neighborhood kids and spreading it around that way. The point is if you're someone who's picking up the virus from another state and bringing it back, you are the one spreading it through your state and causing problems. So what is the lasting impact of this? Well, the unfortunate reality is states aren't able to keep up with the amount of people who are being hospitalized. Right now, here's an article from Missouri that says, "We're drowning at the hospital. Local doctor starts petition to get Missouri governor to implement mask mandate." This is from November 30th. There's an article from the New York Times called "COVID Combat Fatigue. I Would Come Home with Tears in My Eyes," that talks about the anxiety that doctors and nurses are going through trying to deal with all of these situations. You have a case in Arkansas where a children's hospital had to start treating adults to free up beds in other hospitals. And I think most scary of all is that the University of Maryland, and while this is a very short span of time, the University of Maryland actually is allowing nurses who are graduating to leave their program 17 days early. They were supposed to go out and graduate on December 17th, but they're actually graduating on November 30th because they were being pushed out into the workforce as quickly as possible. There are not enough nurses right now. There are not enough hospital beds right now. There is not enough protection equipment out there right now. And as people keep ignoring the severity of this virus and keep remaining open, and I know the economy, we have to stay open because think about the businesses. No. If you really want to think about the businesses and you really want to think about the economy, even in that particular circumstance, you need to shut down. Having all of this open is just going to prolong it and expand it, and people have been saying that for months. For literally months. So I think that given all of this, and given the fact that these nurses are having to work 24 extra hours in a week, are having to work extended overtime, some of them are working while asymptomatic. They have the virus, but they're asymptomatic and they're forced to work. Testing isn't widely available for certain nurses, but yet athletes seem to be able to get their hands on it all the time. We're in a really messed up place where we're trying to protect the semblance of normalcy and just pretending like everything isn't in flames around us. That this isn't something that's spreading like wildfire across the country, and we don't have the resources to handle this. Yes, the vaccine is coming soon. Yes, there are all sorts of ways that we can, hope for the vaccine to be this miracle cure. But we're not 100% on that either. Yes, the testing is great, but some of the reports have shown that it was 95% of things? Meanwhile, how many people traveled during Thanksgiving this year? How many people were traveling from state to state? How many people are traveling across this country? And you have to ask yourself after all that, and with these hospitals not being able to handle patients, and it's not just coronavirus patients that suffer with this, right? It is if you break your leg and you need to go to the hospital. If the entire hospital's been turned into a coronavirus ward, where do you go to get your broken leg dealt with? In a parking lot in a tent? I mean, come on, like, we need to slow this down. So, while the federal government is dawdling on everything else, while it's preventing stimulus checks and not passing the legislation that it needs to prevent evictions, which you can check out some of my recent videos on about stimulus checks. We need a federal response to this pandemic. We need something that says across the board that what certain states can and cannot do. We need to create a system that's tiered and probably modeled off of what New York had started doing. And the horrible thing about all this is even if we get to this point where we create a federal mandate, there is every chance that the Supreme Court will attempt to claim that it's unconstitutional for some reason or another. Probably for religious protection or some other business-oriented thing about keeping businesses open and it violating the First Amendment. And I'm just honestly sick of it. I'm just honestly sick of it. I know we're all frustrated, right? Like, I know we're all genuinely frustrated with this situation. But wearing a cloth on your face isn't that big of a deal in the grand scheme of everything. You know, the conservative reactionary types will be the first ones to talk about how, you know, women need to cover up their skin and their bodies, or they'll need to talk about how, you know, certain styles are inappropriate, but then you don't want to put a mask on? Are you kidding me? Like, their perspective is just so ingrained in this ideology that's ready to sacrifice people on this altar of conservative, reactionary positions and this capitalist paradise they're trying to create. Let the free market in and let everyone die. I think we need a federal program. Think we need to take steps and push for that. Talk to your Congress people. Put the message out there. A lot of people have Twitter these days that are in Congress. Message them. Send letters if you have to. Send emails, whatever it takes. Appeal for this. Appeal to get these states shut down because nurses don't deserve this. The American citizens don't deserve this. And we need to shut this virus down. Because if we don't put it on lock, we are going to have it spread continuously like wildfire. And possibly this vaccine, if it doesn't work out, it's going to continue harming us for quite a foreseeable future. With that said, if you like this video, give it a thumbs up, hit the subscribe button, and hit the bell for notifications. Feel free to follow me on Twitter and check out my Discord in the description down below. And my name is Anarchist Tara, and I hope you enjoyed watching.